Good afternoon, my name is Brandy Martin. Here with me today is Marcia, who happens to be a psychiatric nurse at St. Clair. She is going to be talking to us today about her career as a psych nurse, obsessive compulsive disorder, and treatments and medications that someone with obsessive compulsive disorder could use. So good afternoon, Marcia, how are you?
Good. Hi, Brandy.
To get started, what is obsessive compulsive disorder?
Obsessive compulsive disorder is one of the mental health disorders that falls underneath the umbrella of the anxiety disorders. And obsessive compulsive disorder has two parts to it. A person has obsessive, intrusive, repetitive thoughts that happen on a daily basis typically, and they know the thoughts are irrational. The second part of the disorder is the person has compulsions to do a ritual or behavior, where they have to do the same behavior over and over, and this behavior doesn't make sense. Again, it's an irrational behavior, but by doing so, their anxiety decreases.
What are some specific examples of OCD itself?
First, I'm just going to read you some examples that might help before I explain them. One example is a woman visits her dermatologist complaining of extremely dry skin and seldom feeling clean. She showers for 2 hours every day. Another example is a lawyer insists on making coffee several times each day. His colleagues do not realize that he lives in fear that the coffee will be poisoned, and he feels compelled to pour most of it down the drain. The lawyer is so obsessed with these thoughts that he spends 12 hours a day at work, 4 of them worrying about the contaminated coffee. These are actually 2 real-life examples, and part of what happens with OCD is these obsessive thoughts and these ritualistic behaviors impact a client's day, that they end up being late to school or late to work because they're too busy trying to do these ritualistic behaviors. Some other examples are aggressive obsessions. They're afraid that they're going to hurt somebody or kill somebody. And again, it's an unrealistic, irrational thought process. They might need to do counting rituals, or they might need to do ordering rituals or cleaning rituals. They might have a hoarding type of OCD where they can't throw anything away. And that, again, that hoarding type personality falls underneath the OCD mental health disorder. So again, it's the thoughts related to the behaviors, the rituals to help decrease those obsessive thoughts.
How is one diagnosed with obsessive compulsive disorder?
Obsessive compulsive disorder is diagnosed, as all mental health disorders, with a mental health professional asking the client about their symptoms. So basically taking the history from the client. There's no blood test that a doctor can do to say, oh, you have OCD. So what the doctors and the psychiatrists, psychiatric nurses do is they use this DSM-4 manual. It's a very thick book. This has all the mental health disorders in it. And OCD in this book is chapter 33, and there's going to be a list of symptoms that the doctor or psychiatric nurse is going to ask. And the client has to have a certain number of these symptoms. And if the client does, then they do get the diagnosis of OCD.
How would you treat OCD?
OCD is treated with a variety of things. Number one would be medications. The selective serotonin reuptake inhibitors is the main class of meds, and that would be meds like Prozac, Celexa, Luvox, Zoloft. An older type med is called a tricyclic antidepressant, and that's going to be a Nafranil. That has a little bit more side effects, so it's usually not the first line of treatment, but is still used. The other treatments are going to be the therapy type treatments. We do exposure therapy, where we're going to expose the client to what they're afraid of or what they're obsessing about, and we do it in very small steps. We start out with a very small step, and we keep moving up in increments, and by doing that, the client then will be adjusted to not have that intrusive thought anymore. We do cognitive behavioral therapy, where we look at that negative or irrational thought, and we train the client, teach the client to restate or reframe that thought to a more neutral thought. We do stress management therapy. It's called healthy diversions, and this is good for anybody, where you exercise, eat healthy, do meditation, listen to music, anything that can help you distract your mind in a healthy way, and physical things that will to wear yourself out. So healthy exercise would be good.
Who is affected by OCD?
OCD is affected. It can be male or female across the board. It can be any socioeconomic background. There is a genetic predisposition to OCD with some people. If people have been exposed to certain traumas as children, they could be predisposed to develop OCD.
Is there any prevention for OCD?
Yeah, that's a good question. For any of the mental health disorders, the psychiatrists are still doing research on how do you prevent a mental health disorder, and there's still no definitive answer to that at this time.
How would one get help or more information about obsessive compulsive disorder?
That's a good question, because people are afraid to get help. There's a stigma if you are having a mental health symptom, so we want to get the word out. You can always talk to your family doctor. You can always call St. Clair Hospital. We have psychiatric nurses there 24 hours a day that could answer the questions about any mental health disorder. There's organizations called NAMI, National Alliance of Mental Illness, the National Institute of Mental Illness, and actually, I'm sorry, NAMI, the National Alliance of Mental Illness. You can get free handouts from them. This one's on anxiety, this one's on OCD, from either of those organizations. You can download free information, which is wonderful. The internet is a wonderful resource to get information.
How did you yourself become a psychiatric nurse?
I went to nursing school, and the thing about nursing school, you can go to a 2-year degree, a 3-year degree, or a 4-year degree program. So there's several different options. And if you start out at a 2-year degree program, you can actually get a job and start working and make pretty good money, and then decide to go back to get your 4-year degree. I got a 4-year degree, and doing so, and I think at all the nursing schools you do different clinical rotations. So I did a psychiatric nurse rotation and decided I really liked that type of nursing. So I decided to try that field and have really loved it ever since.
What strengths or traits does a person need to become a psychiatric nurse?
To become a psychiatric nurse, and a nurse in general, you do need to be intelligent, which you are, Brandy, so you're not going to have any problem. Yeah. And in addition to just being intelligent, being able to do the study, the coursework, you really have to have, for psychiatric nursing, patience. You have to be very empathetic. You have to basically be willing to listen to people's stories. A lot of them, it's very tragic stories, so you have to be willing to sit and to be an active listener and not get so depressed by listening to the stories that you can't function at your job. So it really takes a unique personality mix to become a psychiatric nurse. And you have to have a love for people. You really have to be interested in wanting to help people.
All right. Well, thank you for taking your time to talk to me today and answer some questions about obsessive compulsive disorder.
You're welcome, Brandy, and I think you're going to make an excellent psychiatric nurse if you decide to pursue that as a career.
All right. Well, thank you.